Hi guys, Dr. Nick here. Today we're going to continue our series on LDI videos, which is low dose immunotherapy. And today we're going to talk about an important topic, which is flaring. So it's the biggest topic in terms of why it deters some patients from actually undertaking this therapy, which is a great therapy, and I wish more people would do it for that reason. But I can understand from the perspective of when you flare, it doesn't feel great and you don't want that. So I'm going to give you my lowdown on what I do with patients who are flaring in terms of how we have tried to avoid them from flaring. So first, like we talked about previously, our goal is always to try titrate the patient to their core dose. And within that titration, there might be a possibility of symptoms getting worse or a flare occurring. But in the case of sensitive patients, whenever we have one, especially in my office, what we try to do is we think in terms of if they're sensitive, we're always going to start them at a much lower dose than we would the average person who can handle it. Because again, their immune system is dysregulated, they're overly sensitive in terms of their immune responses. Therefore, it's better to take it slow instead of being too aggressive to find that core dose. I'd rather take 7 weeks of trying to find the core dose than physically flare somebody and they have worsening symptoms for maybe a week, 2 or 3, etc., or maybe just a day. But that's kind of the goal of what we try to do. So our goal again is to kind of start at a weaker dose. So example would be with a yeast mixture. So the yeast mixture is very broad. So people can be anywhere within that range. So again, it can be anywhere from like 5C all the way over 30C. And that's what happens with some patients. So the sensitive patients are of course on the 30C range, which is that more the energetic level when there's no material matter left in it in the actual LDI, but it's more of an energetic kind of imprint. And then you have more of the material people, which are more towards maybe below 10C or something of that nature. So with the patient that we know that's sensitive, maybe an average starting point for them could be 25C, just because of the fact that we want to take it slow, we want to be sure of ourselves, and we rather take it slow so we avoid the chance of flaring. So example would be in that case, maybe say on average, the average person gets betterment of some of their symptoms around 17C. It's still fair to use 25C just because maybe that person gets some benefit at 23C. And we would have missed that, and then we would have flared them if we started them at 17C. So we don't want to do that at all. So it's better, like we said, we have 7 weeks before we can reintroduce this antigen again once we give it at 1 point. So if every 10 days we were to give it in a sense, or every 7 days, we have 10 kind of doses that we can kind of give a person instead of flaring a person and waiting for 7 weeks. So that's why it's better to go slower and build up and try to find that core dose properly without the chance of flare or minimizing the chance of flare. So that's what we kind of do, because I've heard, of course, a lot of different patients who have been flared by a lot of different practitioners who would just start them off at a strong dose to figure out what's going on. So the second part to when a flare occurs, what it gives information, and that's one positive. Of course, we don't want to go through a flare of any kind. I don't want a patient to be able to go through that because it's not the funnest at all. But of course, when we're doing it in a more direct manner, there might be just a minimal flare compared to a very strong flare if we're titrating and we're starting at much weaker doses. So that's one possibility where it's maybe a 1-day flare, which is just gives us information. So the information that it gives us is that, again, there's an immune-mediated trigger from that specific LDI antigen that we just introduced into their immune system. So that tells us that whatever symptoms did get worse that time when the flare occurred, there's a possibility of those symptoms becoming better. We don't know exactly how much in terms of that, because we still have to find a core dose and maximize that in order to see that betterment, but that's the information that it gives us. So like we said, there's 2 parts to the flare. There's of course the negative part, which is symptoms get worse, but there's a positive part where it tells us that this specific LDI antigen mixture is important for you, and it's going to be helpful when we find the core dose. So I hope you enjoyed this video. I hope it was informative, and I hope it gets you to do LDI once again, because it can be a beneficial therapy for many people. So don't stop it just because you heard some bad stuff about it, because there's other people who have benefited much by it. So again, thanks for watching. Hope you enjoyed. Continue to follow me so you can see the next new videos I do with LDI.